welcome to this event. My name is Promise Lee. I'm a member of Lausan Collective, and welcome to this Cleaning Workers political exchange. So I'm gonna do a quick, this event will go for about 90 minutes. And again, there will be proper interpretation in each channel. And we will give some space to each region to say a few words before opening up to Q&A, right? And sorry, let me just introduce, Lausan Collective. So we're a kind of diaspora group that started supporting movements and struggle in Hong Kong. And we're a bunch of kind of diaspora, Hong Kong Chinese diaspora leftists based internationally who are kind of devoted to connecting a lot of workers and grassroots struggles, in addition to helping out, trying to connect Hong Kongers to other international allies. So that said, let me, again, I'm going to some basic community guidelines. Everyone try to keep themselves muted so we don't have a lot of extra noise. And of course, if there's some sort of trolls or other things in a room, our co-hosts and moderators will reserve the right to kind of kick people out, right? So keep that in mind. There are 3 translation channels, Cantonese, Spanish, and Malay. And the event will be recorded and disseminated. So if folks need to turn their cameras off or do any other security measures like change their name, please do so now, and we'll cut the section kind of off or before that. So again, briefly going through structures, I'll introduce, each group will introduce themselves briefly and go through about 3 rounds of quick conversations before we get folks to talk to each other. And then we'll open it up for Q&A, okay? So let's go by the order of what it says on the event flyer, if that's okay with everyone. So Hong Kong, US, Malaysia, and Colombia. Hong Kong, US, Malaysia, and Colombia, if that's okay. So the first round of questions is, tell us who you are and your union. Just very quickly, any introductory words about your union and yourself that you would like to share. If Hong Kong folks want to go first, just like a couple minutes is fine. This section doesn't have to be too long, just so people know.
Hello.
Oh, sorry. You have to mute the other. Mute 咗下，另外一個電話先講嘅係，因為有和音係。得唔得？大聲少少係。
係 OK 嘛
？OK。
係啦，唔緊要啦，少少和音嚇。我哋係香港嘅清潔工會啦。
Sorry，你熄一熄另外嗰個係 ，sorry， 因為和音。
哦，依家試下熄咗 ，OK 啊，
得 ，OK。
係得唔得？而家標咗啦喎，點樣咁㗎？可能熄咗啲喇叭先。緊要我哋。
Sorry, technical difficulties. One sec.
我知啦，得搞掂，依家應該冇問題。OK， 好，可以嘛
？Perfect。
冇問題啦，係。大家好啦，係啊，我哋係清工會啦，係來自職工盟嘅清工會係啊，咁香港大概係有即係8至10零萬嘅清工人啦，咁就我哋成立咗都有係16年嘅16、17年嘅歷史啦嚇，係咯，咁就好高興見到大家啦嚇，咁我哋係而家開始做埋個 presentation 啦，定係介紹完先再做啊？
咁我哋3 round 嘅，咁你自己介紹，跟住下一個先講下其他啲咩嚇。咁如果有其他介紹講，依家可以講埋。如果唔係之後先講。
聽唔到聲咯。聽唔到聲。
Okay, let me just translate first. Sorry. So let me just translate that first. Sorry. So Denny To, this is Denny from Hong Kong's Confederation of Trade Unions Cleaning Workers Union. And they say, hi, everyone, and nice to meet everyone. And so he briefly just said there are about kind of 80,000 or more cleaning workers in Hong Kong with about, and they've been around for about kind of 16 years with their union. And they'll just kind of say that briefly first before we go more into the challenges and union demands in the next round. So if that's cool for Denny, can we move on to SCIU? SCIU folks?
Hi, I'm Brahim. Can you hear me?
Yep, go ahead.
Hi, I'm Brahim Kone, Secretary Treasurer of Local 26. We are a union of 8,000 members and union of janitors, security officers, and retail workers.
Thank you so much, Brahim. Malaysia, folks? Can Malaysia folks speak?
Hi, everyone. I'm sorry. I'm Ishan from Union Malaysia, Hospital Cleaner Workers Unions. So I'm Industry Relations Officer of that union.
Great. Thanks for that, Ishan. And lastly, from the Colombia side, we have Martin.
Hello?
Yep, go for
it. ¿Me escuchan?
Hi, can you hear me?
Aló, aló.
Sí, lo podemos escuchar.
Mi nombre es Martín Amariles, vivo en Colombia, en Bogotá. Soy de la Junta Directiva de Sinaltrainal Bogotá. Es un sindicato agroalimentario.
Martín, disculpe que lo interrumpa. ¿Me permite traducir, por favor? Lo voy a ir interrumpiendo para que yo pueda traducir en inglés. Hi, my name is Martin Amariles. I live in Colombia, in Bogotá, the capital, and I'm a member of a union. ¿Un sindicato de qué, disculpe, Martín?
Agroalimentario.
Yeah, like he worked, you know, like I'm Martin. I work for a union that works with food, a food union.
Okay, thanks everyone for the introduction. Okay, so this is where I think we can share more about the work for each union, right? So here's a second round. So what are some of the challenges you faced as a worker or organizer in this pandemic? Let me repeat that again for the translators. So what are some of the challenges you faced as a worker or organizer during this pandemic that you would like to share? So Hong Kong side again, go for it first. And remember to mute.
開咗未啊？
得 ，OK， 開咗聲。
唔係，我知個 PowerPoint 開咗。
開咗啦，但係要 share screen。
唔可以 share。聽到嗎？可唔可以 share screen 啊？我哋
依家應該得㗎嚇。
聽唔到，咁咪刪咗。我想得。
Okay, so they're going to share screen. Okay.
係咪可以啊？
睇到。
係聽到係。
OK。但係我聽唔到聲，比較尷尬啲。唔緊要啦。好，咁我開始即係介紹下嗰啲而家嘅情況先。係。咁你拎走。
Can you hear? Danny, we can see the PowerPoint.
可以聽到嘛？可以嘛？
聽到係。你講啊，係。
OK 好。Sorry 係唔好意思，大家見到個PowerPoint 啦，咁我簡單介紹下嘅香港清潔工嘅背景先啦。嗱咁咧就其實 香港嘅清工咧喺公營嘅sector 裏面咧，其實喺90年代嘅晚期，即係其實係金融風暴之後咧，就開始大規模外判，係啦，咁就嗰度都有係即係幾萬嘅工人係外判咗啦。咁因為外判咗之後咧，咁我諗同全世界其他地方都係有類似嘅情況，就係因為外判制度係價低者得啦，咁所以咧就係嗰個工人嘅工資咧係俾個制度咧係即係壓低得好嚴重，係啦。咁樣咧，同時間就因為嗰啲工人咧，其實佢唔係跟個公司去翻工嘅，而係咧佢固定喺某個地方度翻工，譬如話佢係喺某個屋苑嗰度翻工嘅，或者喺某個醫院度翻工嘅嚇。咁當個外判公司佢完咗個合約之後咧，咁就會轉走。咁但係啲工人咧，其實好多時候都唔會跟公司走嘅，咁就變咗咧啲工人咧，其實係會係每2-3年咧嗰個年資咧有重新開始計算。咁而我哋知道好多嘅工人嘅福利咧，包括假期啊、遣散費等等咧，其實都係同嗰個年資係相掛鈎嘅。咁變咗就係除咗工人嘅人工本身已經好低之外咧，佢哋嘅年資補償福利咧都係好低。
係 OK。
咁第二個背景咧就係即係香港整體嘅環境啦，即係雖然就係最低工資就立咗法嘅喺我哋香港嘅2011年嘅時候，咁但係嗰個水平咧係非常之低嘅，咁係港幣就37個半啦，喺而家呢個即係2021年嘅時間，係啊，咁樣咧就係咁，所以咧就係即係其實係香港差唔多係最低薪嘅工種。咁就所以而家我哋大部分嘅工人咧都係有三類人為主要嘅，一類咧就係長者啦嚇，第二類咧就係新移民嘅婦女啦嚇，通常價錢比較低啲啊，第三種咧就係啲少數族裔嘅朋友。咁然後都要有啲，因為講翻嗰個組織工作嘅困難咧，都要講下一啲即係政治嘅背景啦嚇。咁可能大家都聽過。即係其實香港都係以前就係英國嘅殖民地啦嚇，咁而家就係一個即係中國嘅城市咁啦。咁但係其實就係即係中共政權嘅對香港嘅控制都好嚴密啦嚇。咁所以對香港人嚟講咧，其實係即係中共政權乃至係左派咧，都係一啲好負面嘅即係標籤嚟，都係覺得係好差勁。咁與此同時咧，就係其實嗰個香港嘅工運嘅傳統其實唔係好弱啦嚇，咁變咗咧就係即係工會嘅資源有限，而我哋嘅組織基礎咧都係好薄弱嘅。咁最後咧就係近期嘅事件啦嚇，咁大家可能聽過睇新聞都啦。香港過去嗰1-2年咧，其實都發生咗個好大型嘅運動啦嚇，咁就即係反送中運動啦嚇。咁基本上就係即係人民同政府個信任關係係跌到去冰點嘅嚇。咁過往即係政府都會聽下啲人民嘅訴求咧，係去改善啲即係民生嘅政策。咁但係即係近呢2年，基本上就係佢連一啲民選嘅議員咧，都係隨意咁去 DQ 啊嚇。咁變咗咧，就其實即係我哋想再去講嘢好困難啦嚇。咁其次咧就係喺呢個嘅疫情開始咗之後咧，咁我諗即係喺地方度出現，我相信就係有好多嘅係去限制人群聚集嘅法例，即係特殊法例走出嚟啦。咁佢就係用防疫去保護嘅，咁但係實際上咧，等於咧就其實係禁制晒。
想停一停做翻譯。
係，sorry，我 catch 唔晒啊 ，sorry， 唔該，每一個 point 停一停先 ，sorry， 因為我翻譯唔晒個要係。聽唔聽到 ？Sorry, I'm just trying to translate. Catch a break for translation. Okay. So yeah, sorry. Let me just restate what Denny just said. So yeah, folks can see the PowerPoint, right? So I'm just gonna let folks read the PowerPoint, but then I'll just add in some stuff that Denny kind of added, right? So janitors were outsourced and privatized in huge scale, and wages are really low. And there's been a couple of kind of campaigns over the years, but I think since the even though there's a minimum wage in 2011, the wages are really low, and the kind of hours and the kind of difficult schedules of these cleaning workers makes it very hard for them to band together and fight in campaigns to win bargaining power, especially for folks in the margins, like the elderly and migrant women and ethnic minorities. And as folks have maybe seen in the news for the last kind of 2 years or so, the CCP's kind of repression and increasing kind of state violence going on in Hong Kong makes it hard for unions and especially for the left wing to kind of talk about social and political programs, because these things like the left and these kind of discourses are kind of negatively associated in Hong Kong culture because of the influence of the CCP. And the heritage of the workers' movement is very weak, and it's hard to kind of build something from scratch. And the space continued to close with the movement after 2019 and 2020. And with the national security law, it's even harder to kind of do demonstrations. So now, in the name of preventing the pandemic, most demonstrations and assemblies are banned, and it's even more difficult to express these events. On that note, Denny, is this the last slide, or can I pass it on to the next person? Okay, I'll go ahead and just pass it on to the US side first, if that's okay. So Rahim or Alma, whoever wants to go, feel free to go ahead.
Alma, do you want to go?
No. ¿Puedo hablar yo? Okay. 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 Buenas noches. Mi nombre es Alma Bonilla.
Hi everyone, my name is Alma Bonilla.
Okay. Yo soy delegada de la local 26 SIU en Minnesota.
Hi everyone, I'm Alma Bonilla. I'm a union delegate, in Minnesota with SIU.
Algunos de los desafíos que hemos enfrentado como trabajadora y delegada en esta pandemia es que justo cuando empezó la pandemia estábamos saliendo de un contrato de que estábamos luchando por un nuevo contrato. Estuvimos casi 4 meses en la lucha y habíamos estado en medio de una huelga y de mucho lucha
Mariana, no tienes que traducir el español.
Para mejores.
Sí. A ella la estamos escuchando, sí.
Voy a traducir
A mí se me hace un poco difícil porque estoy escuchando de nuevo. Okay.
Dale.
Ahora sí. Entonces, estábamos saliendo de firmar un nuevo contrato y justo se vino lo que es la pandemia y fue una situación muy difícil porque había mucho miedo, incertidumbre, falta de información y sobre todo al principio había escasez de guantes, mascarillas, las cosas esenciales que necesitábamos para protegernos. Y las compañías estaban difícil para que ellos nos proveyeran lo que nosotros necesitábamos. Y por medio de la unión.
Alma, debes parar un momentico para que te interprete Enrique.
Alma, espera que Enrique puede traducir.
Dale.
So she was sharing that when the pandemic did start a year ago, the union had been negotiating at a time like for 4 months, nearly like for 3 or 4 months, our new contract, our new CBA. So the employees were exhausted. There was like this fear because even though that they had been like union for years now, the cleaners of Minneapolis and Paul area, you know, there's always fear when you are negotiating a new contract and you go on a strike, and then like you fear the bosses, you know, they're gonna fire you, they're gonna retaliate against you. So she was sharing like all this like fear that just coming from all this stress from negotiating the contract for 4 months, where we went on strike, where we were, you know, like she as a delegate in, you know, making the invitation to her like co-workers to join the union in the fight. Like right after like we got like an agreement in between companies and the union about this new like CBA, the pandemic did start, I think the same day. So then when the pandemic did start, there was a lack of resources, there were like lack of information, there were no PPE, there were not like gloves and masks. Companies were using hazard like chemicals that would just to, yeah, adelante.
Yeah. Okay. Entonces, por medio de nuestra unión, se creó una campaña llamada Verdad y Seguridad. Eso ayudó mucho porque en el caso personal, trabajo en un edificio que somos entre 30 y 40 empleados, y las compañías no estaban informando cuando habían personas que se enfermaban.
Dale espacio, Alma, dale espacio que te interprete. Dale espacio.
So then, like, you know, like we were using like, we were obligated to use like hazard chemicals, and even like if you know, in the beginning of the pandemic, we didn't want to go to work, we were obligated to go, otherwise we will be terminated. We didn't have the opportunity to decide whether we wanted to continue or not. And then through the union, we did start a truth and safety campaign that, you know, we were fighting to have like a PPE, we were fighting to be informed when there was a case of like COVID-19 within the building. And she was saying that she works in a building with around 30 or 40 like employees there, cleaners. So, you know, it was like this fight to make sure that if you as an employee were exposed to COVID, at least you had the right to be informed that you were exposed.
Thank you. Sorry.
También se comenzó una lucha por que las compañías pagaran a las personas que se iban a cuarentena y para que dijeran cuando alguien estaba contagiado. En mi caso personal, yo me contagié y yo sentí la responsabilidad de avisarle a mis compañeros de trabajo con los que yo tuve contacto directo, y la compañía no le pareció que estaba correcto lo que yo estaba haciendo, y tuve una llamada de recursos humanos como para intimidarme y decirme que yo no podía estar avisando a mis demás compañeros de mi situación de salud porque ellos podían tomar medidas disciplinarias contra mí. Entonces es como de lo más difícil que hemos tenido que lidiar con la compañía.
So, and then she was sharing that even herself, she got like, unfortunately, she contracted COVID. And actually when and you know, and part of this fight was to make sure that employees knew, as again, like that they were exposed to COVID. And for example, Alma, she contracted COVID while working. So then like she felt like, just not because the Department of Health of Minnesota, when you get COVID, like they tell you, please inform like those who were in close contact with you. So that means that, for example, like the person with whom like she carpools to work, like the person with whom like she has like lunch breaks. So she's saying that it was just not the health department telling her, but also like her duty as a you know, as a citizen to inform those who were at risk. And then like she informed like those co-workers, and after that she got a phone call from HR telling her to stop telling her coworkers that they were like, you know, exposed to COVID, that otherwise they would take disciplinary action against her.
Okay, thanks for sharing that, Oma. I'm gonna move on quickly to the Malaysia side. And yeah, just a reminder, keep things brief, but we can move on. Yeah.
Hi. Yeah. Thank you for the questions. I also have my PowerPoint. Let me share my PowerPoint. So I'm an industrial relation officer for the National Union of Workers in Hospital Support and Alien Service. So basically, just a small background on this is we are, this union is actually, most of our member is the private worker who work in the government hospital. So it's a weird system because back to 90, our government privatized the hospital support service, such as like the cleaning service, maintenance service, Dobby service, outsourced to the contractor. So when they started privatizations, so that's where the union founded in that time. So when we have this kind of weird system happened in Malaysia, so we have a worker who've been working in the same position for like more than 20 years, but their welfare, their pay and everything is not increased at all. But even worse, they lost everything, including their benefit of welfare and their seniority every time when a new contractor come in to become their new boss. So, and they will become a new worker again. So this is some of our background. And the most important is like 80% of our union members are women. So this is a small background, but how the challenge that as an organizer, we dealing with the pandemic. So I think Malaysia have announced National Movement Control Order, MCO, in March 2020. So since then, we are having a very difficulty to organize the worker due to that, because we cannot travel to the other state or to the other area because of the movement control. So it's really have a difficult on that part. And the employer also take the MCO as opportunity to do the union busting. So because they know that the union cannot go to the hospital to meet the worker because of the MCO. And so they take the opportunity, like they know the union are not coming or unable to come in. So yeah, this is a great opportunity for them to do all sorts of union busting and harassment towards the worker. And people also feel like, because of the COVID thing, so a lot of meeting or meet up is doing it online, such as today we are using Zoom, right? So then the question is, why don't you all do the Zoom thing or whatever during the MCO? You can still meet the workers, right? So I think another big issue is there is a big technology gap among the worker. First is most of them, they do not have a smartphone, so or not even a laptop or computer to so they have no access to any Zoom or any software that can help them to do some online meetup things. And the second also is whether their phone is have not enough capacity on doing such as like install a Zoom and so on. And of course we have limited data, and also like the internet coverage, the internet connection coverage is not wide enough. Some of their area have very poor internet connections. So this is a big technology gap among the worker, which makes organizer more difficult to access the worker due to the MCO. Even until now, we are still struggling on that. So we are in our MCO 2.0 at the moment in Malaysia. So we are still having the similar problem, the same problem seen last year, March 2020. And I think the last part as organizer is the enforcement of Industry Relation Act is extremely poor. We have a very good law, act, which is Industrial Relation Act, is to have a good relationship in between the employer and employee. However, the enforcement of this act is extremely poor. So although we have an Industrial Relation Act protected the union member to from any harassment from the employer, but the enforcement is poor. So no point that we have a law, but the enforcement is like not function at all, right? So this is the challenge that we're facing as an organizer. But if as a worker, so of course, they're having a lot of harassment and threaten from their superior or from their supervisor or even manager. And they are not allowed to participate any union activity and even not allowed to have a worksite meeting during their break time, which is actually violated the Industrial Relation Act. But back to the previous, what I mentioned just now is because the lack of enforcement, so it's actually what we call, so it's like the employer can do whatever they want lah, basically. Then the harassment and the threaten they receive is likely like if you attend any union activity or you participate in any union activity, you are not allowed. I mean, I will not give you OT. You will not get any OT. You will, I will change your off day anytime to any day, anyway, day, right? I will give you a very bad locations, working locations for you to work in hospital cleaning and so on and so on. And this is what they're having a problem. So, and then although the hospital cleaner is also one of the frontliner, but they also have a lot of problems such as like what they've mentioned in other countries as well. They have not enough PPE. They are not giving a COVID test, although they have close contact with a COVID patient. And the government giving allowance, special allowance for the COVID frontliner, but the cleaner doesn't get any of it. They are not recognized as the frontliner as well. So this kind of problem also having the challenges as a worker, as a challenge during the pandemic as a worker. I think I will just stop here. Thank you.
Okay, thank you, Ishan. Okay, all right, last one. Is Martine still here? Okay. Martine, do you want to go?
Martín, ya puedes hablar.
Listo. Pues ya la presentación la hice, ya pues hablaría sobre la situación del COVID acá con los compañeros que estamos afiliados, ya que se nos presentó de un momento a otro y la empresa pues no tenía lo suficientemente organizado, pues no se dieron en el momento preciso los guantes o los tapabocas. Entonces tenemos también compañeros del sindicato que están en hospitales y clínicas. Entonces, pues se presentó muchos compañeros con la epidemia y los mandaban para la casa. Los que estaban enfermos y si la EPS no les daba la...
Te voy a interrumpir para que yo pueda traducir.
Listo.
So he is sharing the situation in Colombia with his labor union. When the same thing, when the pandemic did start, company did not have the proper PPE, They didn't have masks, they didn't have gloves, but still they were required to do the job. And actually, you know, there are like a lot of like members of his union that are right now in the hospital, that they are now like in clinics because they contracted the virus. And it's still, you know, a big fight to get the PPE. Ajá, ¿puedes seguir, Martín?
No se les daban pues los tapabocas o los mandaban de ahí por aislamiento, o las EPS no les daban las incapacidades, se los descontaban de las vacaciones y parte del sueldo no se lo pagaban. El caso mío, pues también me sucedió el mismo problema. Me mandaron para la casa y me descontaron de las vacaciones. Pues ha sido un problema muy grande porque devengamos un mínimo y al devengar un mínimo, pues las familias quedaron sufriendo por esa situación para el resto.
Okay, so they didn't have the PP that they needed. So even like say if they got COVID or like they were exposed, they were sent home without pay, or like or like companies would not tell them about their benefits, would not like process short-term disability or like the corresponding FMLA, like in Colombia. They wouldn't process the short-term disability, but instead companies would just simply use their vacations. And many of them also were at home without pay, which, you know, at the end means that they were struggling to make ends meet, to make their families to survive with no income.
Por lo cual hemos tenido la necesidad o la obligación de actuar por medios legales para que nos devuelvan o reconozcan parte de lo que nos ha quitado la empresa. La empresa es una multinacional Sodexo y pues a pesar de ser una multinacional nos ha aporreado muy duro con el problema del COVID. Pues estamos en el proceso a ver si de pronto podemos lograr que se nos devuelva parte de lo que se nos quitó.
We needed to take legal action against company to make sure that all those vacations that they took out of our balances are going to return. And even though like that big company, it's transnational, it's international. You know, like they were not afraid of that, and they did start like legal action against company, and they are in the fight, hoping that they will get back all the vacation time that company unfairly took out of their balances.
A pesar de que somos los únicos que podemos como alzar la voz, ya que que estamos sindicalizados, pero hemos tenido también muchos problemas por la parte de la violencia, a donde ya se nos han matado o nos han asesinado más de 4,000 compañeros sindicalizados en Colombia. En el sindicato de nosotros, Sinaltrainal, van 25 compañeros muertos y otros compañeros que les ha tocado salir del país.
And you know, and like technically we have like the good fortune or like the good luck to be like union, so then we can unify our voices to fight for that, but like that's not a warranty. And he's putting like, for example, like in the last few years, over 4,000 union organizers had been killed in Colombia or had been kidnapped in Colombia. And he is sharing that, for example, in his union, at least 25 of the union members, union organizers had been killed because like their union work, and many had fled the country, you know, seeking like asylum in other parts of the world because their involvement with unions.
Por lo tanto, pues buscamos la solidaridad internacional para que por lo menos para que no nos maten o para que por lo menos alcemos más fuerte la voz fuera del país.
And that's why we want to make sure that outside Colombia, they know what's going on. So then we can get a little bit, maybe more protection, from the international point of view. So then they won't kill us, or at least they will respect our work with labor unions.
Great. I'm going to jump in and say, and cut Martin off here. Thanks for sharing. We're going to do one more short round before opening up fully to Q&A. Thank you everyone for sharing a lot of very, very terrible and exploitative conditions around the world. And it seems like a lot of problems are shared, but at the same time, the scales of violence are different in their own way. So yeah, definitely looking forward to find points of connection. So the last question, and I'm encouraging folks to keep it as brief as they can. So maybe like 3 minutes or so we have enough to go around and also have more room for questions, right? But what are some of your union's demands currently in response to some of the issues you're facing, right? So what are some of your union's demands? Before I pass it on to Hong Kong, let me just say once more in Chinese for some folks who might have joined. 如果你講中文嘅，需要翻譯嘅下邊應該有個地球嘅標誌，撳一撳個標誌就應該有中文翻譯㗎啦。Okay. And a similar message is said in Spanish. So I'll pass it on now back to Denny and HKCCU to talk about the union demands and add on some stuff. Denny, go for it. Denny, can you hear us? We can't hear you. Sorry, give us 1 second with the Hong Kong side.
喂，可以嘛？聽到嘛
Okay. Oh wait. We can't hear now. It worked just now. I think he muted. Yeah, go for it.
而家 OK 啊，而家 OK 啊嚇。OK， 啱啱冇講到一啲係即係清潔工喺疫情期間嘅情況啦嚇。咁就我諗同其他地方相似，就喺呢個疫情爆發早期啦嚇。咁就其實都係嚴重缺乏裝備嘅嚇。咁就我哋都做過啲調查啦，咁啊發現其實即係超過30%以上咧，其實冇任何嘅口罩係可以攞到嘅喺啲僱主上面嚇。咁呢個情況咧，其實都維持咗幾個月，就直到係差唔多年中去到夏天嘅時候咧，咁就香港嘅口罩供應咧先穩定翻啊。咁第二個情況啦，就係我諗唔同地方都會係想要求一啲嘅疫情期間嘅津貼啦，因為即係清潔疫情期間個工作係辛苦咗好多啦，同埋個風險高咗好多嚇。咁但係就係香港政府係有俾少少錢嘅嚇。咁但係嗰個即係津貼嘅發放方式咧，就即係好唔全面啦，亦都係其實金額好少啦嚇。咁最荒謬就係咧，就係即係風險最高嘅醫院清潔工咧，反而係攞唔到任何嘅津貼嘅，係好難理解嘅嚇。咁然後第三個 OK 嘅話，我翻譯 OK 係嘛？
佢好似等一陣。
Okay. So actually,
okay.
Finish first. Yeah.
做埋先，講埋先。
咁另一個情況咧，就係我唔知其他地方會唔會都出現啦，就係當如果個工人喺工作嘅環境時間裏邊係感染嘅時候咧，咁就正路應該係有啲工傷嘅補償嘅，係啦。咁但係個問題咧就係在於咧，就係如果個僱主佢提出懷疑啊，其實你嗰個感染係唔係真係工作期間感染㗎，還是喺屋企感染啊，還是係公餘時間感染啊？如果佢咁樣提出懷疑嘅時候咧，咁工人好多時候都係好難證明咧自己真係喺工作期間感染嘅。 咁如果工人證明唔到嘅話咧，咁咧就會係得唔到任何嘅工傷補償啦，包括係工傷病假錢啦，甚至乎係因為感染病毒而有造成殘疾嘅啲補償啦，都唔會有任何錢可以攞到嘅嚇。咁所以就係去第二頁咧，就係我哋其實就係講緊咧。香港
So Kennedy, can you ask them go back to the last point, last page? Okay, yeah. So yeah, just basically what Denny said was already covered in the PowerPoint, but I'm just gonna read some parts out in case folks who are calling my phone can't hear. So when the pandemic hit, there was a severe mask shortage, and a lot of the janitors, 30% didn't get any masks from employers, and about 40% had less than one mask a day average. And this situation continued for a number of months. And this government only provided subsidy to the janitors once, but it's very not very full and very little. And that amounts only about 7,000 Hong Kong dollars. So that's about like 1K US dollars or something. And hospital janitors aren't included in the subsidy list for some reason. And then the more absurd thing is when workers get infected, the employers and the insurance companies can appeal and challenge the facts to see if they're in the workplace. And if the workers can't prove the fact that it's a work-related injury or it's an injury in the workplace, then they can't get any work injury paid leave or any kind of compensation. I'll pass it back to Denny for the last slide.
OK， 係啦，咁最後都係講翻幾點，即係我哋工會嘅訴求啦。咁我諗其實同其他地方相似啦，就係都係要求要有足夠嘅 PPE 啦，同埋就係免費定期檢測服務。咁呢方面其實香港都算還可以啦，我相信係。咁但係例如其他譬如話一啲嘅津貼咧，咁就係已經係冇再發放過啦嚇。咁另外啱講到就係嗰個懷疑工傷嘅問題啦。其實香港嘅法例有一種講法咧，就係如果某種病可以納入為咧法例上面嘅職業病嘅定義嘅話咧，咁咧就係唔需要咧係去由嗰個工人咧係去舉證咧佢自己係工作期間感染嘅。咁我哋好多嘅勞工團體都係即係要求政府係將呢個嘅新冠肺炎啦係納做職業病啦。咁就令到嗰啲係工人啦係可以攞到工傷嘅補償嚇。咁最後咧仲有個小問題啦，但係都唔少嘅其實，就係咧其實當有病毒喺個社區或者工作環境出現嘅時候咧，其實嗰啲工人咧係需要係隔離甚至被檢疫嘅。咁但係當隔離被檢疫可能係14日甚至21日嘅時候咧，究竟啲工人有冇糧出咧，係一個即係大問題嚟嘅嚇。尤其是基層工人可能係手停口停啊嘛嚇，咁所以就係即係嗰啲隔離期間究竟有冇錢出糧咧，就係要去視乎翻即係工人嗰啲即係唔同情況啦，譬如話個年資夠唔夠長啦，個年資唔夠長，可能就冇足夠有薪病假啦嚇。咁所以就係如果嗰個隔離檢疫甚至乎係治療期間，工人係有啲嘅薪金被係損失咗嘅話咧，其實政府係應該係補償翻嘅。否則嘅話咧，其實除咗係個工人嗰個生計之外咧，其實亦都係可能造成咧，就係嗰啲工人咧係隱瞞佢其實曾經接觸過一啲嘅確診者嘅情況，咁就令到病毒咧係更加係容易喺社區嗰度擴散開去。大概係咁。
Okay, yeah, thanks, Denny. So yeah, alongside, he's just giving a bit more context on the PowerPoint page, but he's already saying in terms of some of the, obviously in terms of larger societal things in Hong Kong's kind of COVID protections already a bit better in some sense, but still, right, in terms of economic things, right, in terms of compensation and all these things, it's still very hard to fight for adequate compensation and protect economic protections for workers, right? So one of their key demands is to ask that the COVID-19 thing can be listed as an occupational disease under this employees compensation ordinance so that frontline workers can be protected and be counted into more legislation that would cover work injury and other things. So like, for example, going back to his last point, if workers, if COVID-19 is included as a occupational disease, then workers don't have to prove for themselves that it's a work thing, and there's more. It gives it's easier for the workers to get compensation without having to jump through all these hurdles to prove that it's somehow like a workplace injury, which is a very hard category to actually kind of get into. And it's easy for the employers and the government to kind of absolve their responsibility on that basis. So yeah, it's just that demand. And also, you know, once there's once they already caught the virus, workers need to quarantine. And right now there's not a lot of ways for the workers be guaranteed compensation during the quarantine period, right? So once the workers don't work, they don't get any money. And there's not a lot of ways right now for these things to be protected and covered. So we, you know, and there's a lot of other aspects like seniority and other things that determine whether they would actually get compensation, even if they catch COVID. So that's another problem that that the union kind of want to address, right? And the last couple of demands was, right, like more monthly subsidies to frontline cleaning workers until pandemic is over, and paid leave, and the kind of other things that you just said. So things that we'll go through, sorry, so I think the US folks, SCIU folks, you want to come in and speak.
Hi, this is Brahim from Local 26. So for Local 26, we're fighting on two fronts. One is with the companies. We first introduced a set of agreement with the company. And the first one was around providing PPE for the workers, and also make sure that they, whenever there is somebody sick in the building, they report that to the management, to the rest of the folks in the building. And we also push the company to respect when they're laying off people by seniority. So that was the first demand that was sent. So the second ones, we just sent that not too long ago, still working with the company and around quarantine pay and around layoff. We have about 800 members affected by COVID, and 4 of our members died. So we're taking COVID very serious. So the unions used our members' own money. We set aside $300,000 US to pay for quarantine whenever one of our members is sick, because the companies are refusing to do that. So we have to take care of ourselves in this, but now that money is not enough. So as this weekend, we trying to raise some more money for the members. So that's one of the fight that we're doing, and that's with the company. Of course, that's not enough. So at the city level, we also are fighting at the city and the state capital to introduce a bill. If that's passed, our members will have 100 hours of quarantine pay, and that will go way back to March of last year. So we also wanted to make sure that our members be in the front line whenever the vaccine, is getting to folks. So our members who are essential workers be one of the first group to get it. So we're fighting at the state level to get that for our members. So as you also know, in our contract, we have a lot of languages that's expiring. As an example, the layoff in our contract is 1 year, and COVID's been here. We're going down the second year of COVID. So we want to make sure that our members that are on layoff right now, instead of 1 year on layoff, we want to extend that to 2 years. So we're pushing the companies to agree to that. And we want also the company not to make vaccine mandatory for our members, because not everybody trusts that vaccine that's out, even though, it is a good news that we have a vaccine, but it takes time for people to really want to get a vaccine. So we want, whenever we get in line to get a vaccine, we don't want the company to make that mandatory. So that's basically the big demand on the table. Of course, PPE, you know, always, that's something that we want all our members to get. Green cleaning, because of all the hazards and the chemicals that people are using. There's a lot of new chemicals now because of COVID. So we want to make sure that the company are using the right chemicals for the members.
Thanks for sharing all that, Brahim. I'm sure we'll get to talk more about ways to support each other and delve more into demands later in Q&A. Yishan, ready? Okay.
I think our demand also quite similar like others hospital cleaner, right? The thing is the government have to recognize a hospital cleaner in Malaysia as one of the key frontliner. It's not about the recognize as just as a title, but it's also all the benefits or allowance or protections should also cover under given to the hospital cleaner. So this is one of the key things. And also the second thing is because as I mentioned in my previous PowerPoint, is actually the worker have been working for like more than 20 years, but their welfare, their seniority all lost because every time I'm changing the contractor, it will become a new worker. So one of our key demand also is the government should absorb all the hospital cleaner who work in government hospital back into the government staff, because previously they are government staff. It's just because our government privatization, the whole service contract out to the contractor, and therefore they become a private worker. But and therefore they have a lot of problems, such as like I said, the seniority and the welfare and everything. So in order to resolve that problem, I think one of the key things is they should be absorbed back as a government staff, like they do back in 90. So this is one of the key things, and I think it will help to resolve the hospital cleaner workers' problems. And the third one is stop all form of union busting. This is one of the key things, the key demands that we've been calling for years, right? Because it's a union busting, very serious, and it should be stopped all form of union busting. No harassment, no threaten, and the worker should be allowed to do or participate any union activity during their break time. So this is our key three demands, and we just received a good news. I think maybe there's something to cheers other up. I'm not sure, because we just have a good news that our country will start a program of vaccinations for citizens. So for the first phase is only for the frontliner. And before this, our government said, oh, hospital cleaner is not the frontliner, therefore they will not receive the vaccine in the first phase. They will receive the vaccine like others citizens if they're registered. But it's a good news is yesterday, the government have announced that they recognize the hospital cleaner as a frontliner. Therefore, the hospital cleaner will be in the first, receive the vaccine like others frontliner in first phase. This is very good news. So we are so happy to hear this news is happening. So maybe our comrade or in others country, we should really like still work on, give more pressure on pushing to make sure our worker, especially hospital cleaner, to get the vaccines, because they are important, especially during the pandemic COVID-19. Thank you.
Yeah, thanks for presenting that, and thanks for sharing the victory too. I think that's a very important thing to share amidst of all the things we just heard too. So thanks for that. And lastly, I'll pass back to Martin before we open up the Q&A. So Martin, go ahead. Martin, can you mute or unmute?
Martín, ahora usted puede hablar.
Sí.
Sí, entonces lo que yo decía era que, pues, que en este caso, pues, demandamos y a construir una solidaridad internacional para denunciar todos estos casos, ya que en Colombia tenemos la situación de que las vacunas que llegaron a Colombia, las primeras que llegaron fue 50.000 y estos diticas llegaron como 150.000, pero no son suficientes para la cantidad de personas que somos en Colombia. Somos 50 millones y no le está llegando a todo el mundo y a la gente menos favorecida, por ejemplo, la gente que vive muy apartada acá de Bogotá. Entonces, pues la demanda que hago es esa, que nos solidaricemos en esta situación, tanto para acá como para los otros países que estamos en una situación tan delicada.
Perdón que te interrumpa, Martín. Voy a traducir. So he's sharing that he makes an invitation to create a international coalition to make sure that everyone is aware at least of what's happening. You know, for instance, in Colombia, he was sharing that I think they got a first batch of 50,000 vaccines, and I think like last week, something like that, they got another batch of 150,000 vaccines. But the issue here is that, of course, those vaccines are not enough, as Colombia is a country with 50 million people, and so then like 200,000 vaccines are not enough. And of course, like the people who is left at the end, you know, for the end of the vaccine like time frame are those who are like, you know, less, you know, that are like, you know, like in need, like people who may have like lack of resources to access the vaccination, many frontline workers, many people that live in the provinces out of the capital. So, you know, he's making this invitation to create a international solidarity like coalition to make sure that everyone is aware of what's happening in each other countries regarding vaccination.
Y agradecerles a todos los que colaboraron con este foro para que las voces que no somos escuchadas se nos escuchen por este medio. Muy agradecidos a todos ustedes.
And thank you for this opportunity to participate and to join this forum that give voice to those who, you know, unfortunately cannot raise their voice because like some dangers. So yeah, thank you again, and he's very grateful to for being invited to this forum.
Thank you so much again. And yeah, thank you everyone for sharing. We have, we officially have 20 minutes left, but I think I might extend the period of time depending on how the discussion goes, if that's okay with everyone. So yeah, Q&A time. If anyone has questions, feel free to drop them in the chat, and I'll try to call on the questions in order. But first, you know, I also want to prioritize, are there questions that the unions themselves, the speakers, want to ask one another? If so, feel free to unmute, or again, drop the question in the chat, or I'll call on you. But if so, the speakers feel free to unmute if you have a specific question you want to ask, or comment you would like to make towards the other unions.
De a uno nomás, compa.
Anyone want to start first? Okay, if not, maybe I'll break the. Oh, sorry, Greg. Do you wanna come?
So my name is Greg Namaker. I'm president of SEIU Local 26, and just incredibly excited about this exchange and this discussion. And so thank you for all of the organizers who helped pull it together. You know, it's just amazing to me in this discussion how many of the demands that each of our different cities, Kuala Lumpur, Hong Kong, Minneapolis, Bogota, were separated by the entire world, and yet 90% of the things that we're fighting for sound exactly aligned. So it really is incredible. One piece that we've not talked about yet in this space is within our own membership, there are a lot of fears and many people who are nervous about taking the vaccine. So it is, you know, in the US, that is a very politicized issue because of President Trump and the way that the politics happened in our country. Is that also happening in some of your memberships? Are you seeing that, and what are you doing?
Yeah, I will go first. So I think the sentiment is definitely happens not amongst our union member, but also in the general public, right? So, but I think this is also our, we see as our duty also to raise the awareness of educating our members on this matter, especially how important of the vaccines that can protect them when they are doing work as in a COVID ward and stuff like that. I think we feel like we should take up the responsibility on that part. Of course, the government also should do that. However, the government failed to do so. So I think we shouldn't wait for the government lah. We start ourselves first. Yeah, but at the same time, we're also conducting a survey among our union member about because as our government promised, our hospital cleaner will become will receive the vaccine and everything. So we were monitoring and a survey among our members. How do they feel? Are they receiving and so on like that? This is what we're currently doing.
Any other speakers? Oh, go ahead.
Yeah, I heard that I believe Malaysia saying that whenever a new contractor comes, they try to change. They try not to respect people's seniority. I want to know if there's no enforcement language in their contract. How they deal with this kind of situation?
Unfortunately, no. So every time when a new contractor come in, they are given a new contract to sign, and how whatever seniority is actually is invalid, is void, and everyone start from the beginning as a new worker. One thing I think because our country we have a minimum wage act. So it will always back to a minimum wage every time they're renewing their contract. Because if like the seniority we have, if you're working 20 years, your annual leave, your MC and everything will be increased, right? Normally, but no, it will all back to like a new worker. So they have no any effort from any party on doing that, unless from our union for fighting on this cause.
Wow.
Denny, are you speaking? Sorry. We can't hear.
定係用呢個講。
Okay. Okay.
講同聽用呢個，係啊。
撳落去又係。
唔使乜都唔使，你就咁對住佢講得㗎。
係啦，都想講翻，即係回應翻關於疫苗嗰個情況啦。其實我哋香港呢邊嘅情況都同美國係相類似嘅，都係
好政治化。由於嗰個政府個疫苗嗰個由採購啦至到相關嗰個數據嗰個公佈咧，都係好唔透明啊。咁所以我哋其實係好擔心，究竟接種咗個疫苗咧對身體有冇害啦？都甚至乎嗰個抗疫嗰個能力係去到邊度咧？咁係好有疑慮嘅。而且即係經歷過呢1-2年嘅運動啦，咁其實同政府之間嗰個信任，我哋係差嘅。所以喺呢個情況底下，仲有個別嘅行業咧係基本上係強制性要打咁樣，我哋都好擔心嗰樣嘢會擴展到各行各業性，甚至乎成為一種慣例啦。將抗疫呢件事變成都係一種政府嘅即係手段。係啦，我哋香港大部分人都係有呢方面嘅擔心。係啦，就同馬來西亞嘅情況好唔同。馬來西亞相對地係信任疫苗，但係我哋其實相對地我哋係擔心個疫苗嘅問題。
係咯，sorry， 我補充下咧，就係因為我哋都睇新聞都睇到好多來自於中國製造嘅疫苗咧，其實係嗰個有效性係都即係未係被確立到啦，係啦。咁而即係過往好多即係中國嘅產品嗰個安全問題咧，都經常會出現嘅，即係俾好多人係去質疑啦嚇。所以其實就香港人都唔係話擔心疫苗，不過咧其實係擔心咧個疫苗嘅安全性，尤其是中國製造疫苗，其實咁樣咯。
Okay, thank you for sharing. Let me translate. Sorry, I don't know the name of the worker who's sharing, but so he was just agreeing with folks in the U.S. that it is a very politicized issue, but he wanted to note some differences that they experience in the Hong Kong milieu, right? So it's very politicized in the sense that like the vaccine production has been very, and as folks know, Hong Kong has been able to contain the virus much better than a lot of different regions, but the whole process is very politicized and tied to the government in a very not transparent way, right? From the purchasing process to the distribution process, it's very non-transparent, and actually the main concern in the city on people's minds isn't about the vaccine kind of itself, so to speak, but more worried about specifically the one that is only available right through the Chinese government, whether that vaccine is trustworthy, and whether and folks have heard a lot of information about the fact that a lot of these this specific vaccine from China hasn't been proven to be that effective, right? I think it's somewhere around 50%. And the fact that after 2 years of a very kind of polarizing and difficult movement, I think the trust between most of the city's population and the government has just really completely eroded after 2 years. And so a lot of people are fearing that this is becoming another way for the government to instill and to suppress and to kind of use this kind of discourse of vaccine distribution to further kind of politicize and police and introduce kind of more problematic policies to the populace, right? And there's already a lot of policies actually, which is actually it's like the opposite of Malaysia, right? Where it's not like we don't have access to vaccines, but everyone's forced to take this one single vaccine that's coming, that's kind of legislated by the government. So a lot of folks are seeing vaccines as kind of this suppression issue. So we distrust the government, not that we distrust taking the vaccine itself. And yeah, Denny was just adding on to the fact that, yeah, there's a lot of fears around specifically the products that's being advertised specifically from the mainline government. And so, yeah, just echoing the fact that it's not fearing the kind of medical science behind it, like the same way in the US, but more the fact that we're only kind of offered one option, and that option a lot of people are very skeptical about because of the kind of government support and how that's being kind of framed by the government. So, okay. Anyone else want to respond to that? If not, there's a couple questions in the chat. So I'll give a couple seconds if folks want to add more.
Sí,
¿Puedo decir algo?
Ok, dale, Alma.
En realidad es como un comentario, como trabajadores debería de, no solo aquí en los 4 países, digamos, que estamos hablando, debería de haber una lucha para que las vacunas lleguen a todo el mundo, porque Yo estoy en Estados Unidos, pero yo soy de El Salvador y me preocupa que los países pobres no tengan el acceso que aquí en este país o en los demás países desarrollados hay, y que la vacuna ya está pronto para que nos la pongan, pero hay países en Latinoamérica que ni siquiera han empezado a llegar la vacuna. Entonces debería ser una lucha constante para que llegue sin importar raza, religión, condición económica. Debería de ser gratis a todo el mundo y que deje de existir lo que estaban diciendo, que politicen la forma en cómo vacunan, y pues eso.
So she was commenting that you know, it's more like a comment what she said, that right now she was saying that she lives in the US, but like she's originally from El Salvador. So in her home country, they still like didn't like begin like with the vaccine campaign. So she said that we should all like unite to put pressure like worldwide to make sure that like not only the developed countries get the vaccination, but also like those countries who are like, you know, developing countries, for example, in Latin America, there are a lot of countries that are still like, they haven't like, not even, they didn't like begin like the vaccination campaign yet. While we have other countries in Asia, in Europe, and here in the US, that, I mean, it's pretty good that the vaccination, it's working very well, but like we should not forget about the developing countries. And that in those developing countries, we should make sure that, again, like this won't turn out political, but that like the vaccine will be free and accessible for everyone, regardless of like gender, regardless of religion, political affiliation, because it's just not fair that developed countries get the vaccine, but developing countries not.
Thanks for sharing, Omar. Very important point. Okay, there's a couple of, it seems like there's a lot of people responding to this point, so I'm gonna go through some of these before turning to the question. I'm looking at, I think Edith, raise your hand first, and I'll go to Miss Lee. To Edith, go ahead.
Edith, tienes la palabra, si quieres hablar.
Edith.
Oh, sí, aquí estoy. Qué pena. Buenas noches. Mi nombre es Edith Silva. Soy organizadora en la local 26. Y a mí me gustaría, los 4 países que estamos, continente, lo que sea, que hiciéramos una lucha todos para que puedan dar la patente en todos los países y que cada país pueda crear las vacunas. Porque en este momento Colombia se demoró en comprar vacunas y en este momento no hay vacunas para poder comprar. Entonces, me gustaría que todos nos uniéramos por una sola lucha, de que la patente la puedan dar a todos los países y que cada país que pueda producir sus propias vacunas.
Also, like I would like, okay, gracias. So also Maria Edith was sharing that she would like to be part of a fight worldwide to demand that the patent, is that the word? Like the patent of the vaccine is available for every country. So then like every country can produce their own. Because otherwise, many countries, especially like the developing countries in Latin America, in Africa, in Asia, are like expecting, from, or like they are depending on other countries to have the access to the vaccine. And she was sharing that, for example, in Colombia, like as Martin said before, they don't have enough vaccines to cover all the population. So it will be different if each country have the a way to produce their vaccines, and then they won't have to be depending on like whatever country to cover their population for vaccination.
Yeah, thanks for sharing that, Edith. I'll pass it on to Miss L 公。如果你要翻譯嘅，我幫你翻譯，你可以中文講嚇。咁如果你 unmute 想講嘅，到你係咪？你舉咗手好似有。
Y después, si es posible, compañera, es que no puedo levantar la mano acá. Sí, después de la compañera, porque no puedo aquí levantar la mano.
Yep, promise. Gerardo is just saying he wants to get in the stack after Miss Lee.
Okay, cool. Go for it.
輪到我係咪？
你講係，我翻譯你講一句係。
你翻譯嘅係啊。
即
係因為我聽到咧，即係各個地方嗰啲清潔工，即係喺處理疫情方面咧，都大致遇到嘅問題其實都幾相同嘅。咁我就覺得即係可唔可以即係咁多個國家嘅工會咧，我哋可以喺呢一度即係建立一個即係我哋清潔工嘅一個宣言咧，就俾嗰個政府啊或者聯合國啊咁樣啦。希望咧就係話政府咧其實喺呢一啲咁嘅公共衛生方面嘅服務咧，其實應該係自己負責翻，就唔應該去外判咯。咁另外咧就係即係將我哋譬如話清潔工友面對處理疫情嘅時候，佢哋應有嘅裝備啊，或者佢哋係呢啲咁嘅疫情係咪應該納入呢個職業病啊，同埋佢哋應有嘅賠償係點樣咧？咁我覺得係應該一列出嚟咯。咁然後咧就即係俾每個國家去參考咯。即係點樣處理就即係另外一回事啦，處唔處理到。但係我覺得係即係有個咁樣嘅即係參考嘅一個方式，咁樣俾各地嘅工會去跟咧，我覺得係好需要咯。
好，唔該晒，我而家翻譯先。So Miss Lee was talking about how it sounds like we're coming from different regions and places, but there are a lot of similar and overlapping issues. And she was actually wondering, this is kind of a concrete action item actually. So she was like, can all these different unions come together to establish and draft up some sort of collective international cleaning workers declaration, address the different regimes, to ask for each government to really pay attention to the kind of public health policies of each area, and to demand adequate equipment and compensation for each workplace, and kind of list them all out together. And of course, she's saying it has to be pretty general, and each government have to implement it in its own way. But at least there's kind of a universal list of things that we as unions, or those of us in the fight, can at least bring up to as kind of a recommendation for the international community to raise awareness around this and unite kind of around a central platform. So that's the contribution. And sorry, before I hand it to Gerardo, I just want to name that we're at for the 90 minutes, but we're going to try to go. It sounds like there's a lot going on. So I'm going to push it on, and folks need to go. Feel free to head out. But I think we're going to keep the conversation going a little bit more now that we have some stuff on the table. And again, thank you to our translators. And if each union want to take the time to advertise anything about demands or follow their social media page, please put the links in the chat now so people can have places to know where to support and how to support folks. On that note, I'll pass it back to Gerardo, and then Yishan.
I'm okay.
Oh, sorry.
No, Gerardo, go first.
Okay, perfect.
Okay. Perfecto. Enrique, estás ahí, ¿verdad? Ok. Primero, entendemos que el sistema de salud en el mundo era precario antes de la pandemia, porque hay una legislación que venía privatizando el sistema de salud en todo el mundo.
So first we know that the healthcare system worldwide, regardless of the country, has been getting worse as big companies had been trying to privatize or to monetize out of healthcare.
Sabemos que la legislación laboral en todo el mundo estaba flexibilizada antes de la pandemia.
we know that worldwide, like in many countries, like the legislation about healthcare was, inclined towards like big companies and their profits.
Y sabemos que la sobreexplotación a los trabajadores estaba antes de la pandemia.
And of course, we know that the overexploitation to workers was here before the pandemic.
Lo que hace la pandemia es evidenciar más el problema.
So what the pandemic did was to put in evidence even more like all these issues.
Ahora la cantidad de desempleo que está produciendo la pandemia está enriqueciendo más a las transnacionales.
And now even like the huge amount, like the huge level of unemployment that had result out of the pandemic is making even richer to those companies.
Los pocos empleos que están dejando, por ejemplo, en el tema de limpieza, están recargando el trabajo más a los trabajadores.
Say the few employees or like the few like positions that are being left for workers are causing that those workers who remain employed get a workload like really big.
Hay, como decía Alma, Martín y otros compañeros, cosas que hacer en el sitio de trabajo.
Like Alma and like Martin said, there are like a lot of things to do in the work site.
Organización, lucha.
To organize, to fight.
Pero también se necesita que a nivel gubernamental tengamos incidencia en una nueva legislación en cada estado, en cada ciudad, en cada país, que esté a favor de los trabajadores en este nuevo desorden de cosas.
But also we need to have legislation like in the government level to make sure that all these fights are supported or has like or like have ground in like laws, regardless of the city, country or state.
Como lo que ya se mencionó aquí en Minneapolis, exigir al gobierno que cree leyes para que paguen el tiempo que la gente está en casa por problemas de COVID.
Like, for example, we have been fighting here in the city of Minneapolis, where we are located, SCIU Local 26, to make sure, like, to fight, to have the government obligate companies to pay employees for being in quarantine.
Pero se necesitan también acciones globales.
But also we need global actions.
Necesitamos entender que el mundo transnacional, las grandes corporaciones, sí han creado una legislación neoliberal para esclavizar a los trabajadores.
But also we need to understand that that this fight, it is just not like locally, but it's like a global fight, because like all this is affecting people here in Minnesota, people in Colombia, in Malaysia, in Hong Kong, in every single like corner of the world.
Esta reunión seguramente sirve como un punto de partida para integrar más personas en diferentes países, más organizaciones, y tenemos que crear una plataforma global en favor de los trabajadores.
So hopefully out of these conversations that we're having, we can create something bigger to help each other with all this legislation and all these activities that we are doing to make sure that our workers are safe.
Gracias.
Thank you so much, Gerardo. Let me pass it on to Yishan.
Yeah, I think, thank you. I think for today, I think one of the outcome of today's forum, I think it's not only about people from country shares things, but I think it's also a first step that probably people have talking about the international solidarity things that we should coming out. So actually we are about to suggest that maybe we can form an international cleaning worker. I mean, the name can be put in anyway. I'll just put it first. A joint action group. I think that this joint action group is about to to solidarity each other, and of course it's a networking as well. So when the other countries workers having the problem, then we can quickly respond on that matter in the solidarity way. And of course, we also can networking each other to share resource and stuff like that. And also we should act as a pressuring group, because we see every country having the problem. we're having our problem, you're having our problem, then how we can act as a pressuring group with convention, you know, labor convention and any things that we can use it, then we can come a statement or some action under this joint action group. I think this is what we wanted to suggest, that maybe we can start from us, 4 countries first, and we can always explore ourselves, right? Yeah, this is one of it imply on the comment on how can we support each other. Yeah, thank you.
Thank you so much. It's very, very encouraging stuff indeed. There's 2 questions I can group together, but I'm wondering if Martin from Colombia wants to respond to anything. I just want to make sure everyone has space to speak.
Acciona el micrófono, Martín, por favor. Dale, Martín.
No entendí ¿alguna pregunta?
No, que si quieres decir unas últimas palabras, un último mensaje.
No, pues que lo que acaba de decir Gerardo, pues es lo que debemos de hacer ante esta situación que se está presentando en el mundo. Solidarizarnos con la causa y empezar a organizar la gente para que esto tenga que cambiar, porque vamos de una situación muy complicada. Tanto los países que estamos en su desarrollo y otros países que el problema ha sido mundial y lo que dice Gerardo es muy esencial para que esto pueda salir adelante.
So he's just making echo with what Gerardo shared before, that we have to build solidarity with each other like unions, to make sure that we all build power, and of course to organize employees worldwide and like organize employees locally, to be able to fight with companies, to be able to fight with government, to make sure again that employees are protected. That is ultimately our goal.
Hey, thanks for adding that. Before I go to question, so Miss L, I guess there's one more hand in the audience, so I'm going to go that quickly and then hit a question at least before we discuss a bit more. So Miss L 公係咪仲有少少嘢想講係？係講一兩句係短少少 OK， 因為我哋仲有少少問題嗱，但你 mute 你可以講係。未聽到你喎，
解除聲音。OK， 聽到未啊？
聽到。
係，我咧就係即係香港食環署工會嘅。咁其實香港以前咧都係計劃想將所有嘅即係環境衞生嘅清潔啊，成日全部外判嘅。咁但係因為去到沙士咧，就係令到政府咧就知道咧，即係靠外判係冇可能嘅時候咧，咁佢先係保留翻。即係一啲長工啦，即係政府嘅工作咯。即係話喺危機處理上咧，其實政府係有責任咯。咁即係我哋會即係睇，即係如果你話個政府而家都好多都係將一啲咁嘅清潔服務咧外判嘅時候，其實就應該咧就向市民即係講翻咯。如果當有疫症嘅時候咧，一啲即係為咗賺錢嘅商人係咪真係會肯幫你去做一啲處理一啲社會危機咧？咁樣我覺得係要即係向呢個市民咧都要即係講清楚呢樣嘢，先可以俾到壓力咧政府咯。
唔該晒。Okay, so she Miss L was just saying so she's part of the food department, a worker in like the food. Sorry, a unionized worker in kind of like the food resources. Environment. Sorry, okay. You could type in the chat room. Sorry, say that again.
Food and Environment Hygiene Department.
Okay, food environment hygiene department, right? So she's a unionized worker in there. And so yeah, she's saying how back in the day, the government also wants to outsource all of us to like along with the cleaning workers, but she was saying, they realized that's not totally possible fully, and so they kept some folks. But then her main point was just saying, I think, it's also important to be able to explain a lot of these demands to the public, the general public, right? Because we're not going to rely on the power of the corporations and the capitalists to really help with these crises, right? To help give pressure to the government, but we also need to explain and get the buy-in of folks in a larger community and the people around us as well. Okay, so on that note, I'm gonna hit a question and group a couple questions together in the chat about outsourcing that I think Ms. Liu just kind of mentioned already. But how do unions deal with this problem with outsourcing around the world? And also on that note, what about are there tensions and what does solidarity look like between migrant and local workers in these unions? Are there difficulties, and what are some avenues for solidarities within these things? And in the interest of time, I'm just going to put the other question too. It seems like a good wrapping question. Is that, you know, what can non-cleaning workers do to support all of your guys' efforts? So maybe for the sake of time, maybe we can each region can kind of answer once, you know, any part of they want of these two questions. Does that sound okay? So one about outsourcing and relationship between local and migrant workers, and just say what you want on that. And then secondly, for non-cleaning workers, activists, or people interested, what can they do to help out with your efforts? So answer one or two, but maybe a final kind of comment from each, and then we'll go ahead in the back end to see how we can build some of the international connections more clearly that Yishan and Michelle were kind of suggesting afterwards. So on that note, Hong Kong folks and CTO, do you have anything to say about one or the other questions?
Hello， 係，咁就我揀條問題答啦。嗱，其實喺過去嗰2-3年咧，就係香港嘅外判工人咧，就係有啲進展嘅，就係即係過往我哋都係批評係外判制度係價低者得啦嚇。咁最近嗰2年咧，就係因為即係一單工潮嘅出現咧，我哋逼到政府咧，係去更改嗰個外判嘅投標制度，係啦，咁咧就過往就係大概係6-4比同7-3比，即係6成同7成咧都係睇個價錢嘅。咁而家我哋政府外判嘅合約嘅投標評分咧，就係開始係50-50咁去比重嚇，咁就只係標價係得5成啫。咁同埋我哋都爭取到咧，係工人嘅工資咧佔嗰個評分制度咧係12.5%。12.5%， 咁呢個成效係幾多咧？可能要多啲時間先見到咯。但係咧，我哋見到過去呢2年咧，其實工人嘅工資咧有個幾可觀嘅躍升。係剛剛我present 嘅時候講到就係最低工資係即係都係好低啦嚇。咁但係而家嘅新入職嘅人工咧，其實係比最低工資咧係多係時薪10蚊以上嘅可以去到。咁嗱坦白講咧，就係喺香港，因為都係相對地係即係相信自由市場嗰套，咁我哋都會想係講取消外判制，咁但係即係似乎比較遙遠。咁所以就係我哋都同時間係諗緊咧，會唔會係至少咧係可以係喺外判制度嗰啲嘅細節上面可以有啲改良，令到係外判工人嘅工資同待遇咧，至少有啲即時短暫嘅改善先，然後我哋再去處理取消外判制度嘅問題咯。咁就我唔知道其他地方會唔會都有類似經驗，就係我哋去試下去介入嗰個外判制度嘅評分制度咧，係可以有啲改善出現到。
OK， 我唔知完全明個6-4咩6-70% 嗰個50-50可以講。
嗰個咧即係嗱個投標評分制度咧，佢有唔同嘅因素啊，唔同嘅即係項目計分啦。咁一般嚟講喺香港咧，6成同7成咧都會係呢個嘅標價，即係整個嘅標嘅價錢，即係可能1000萬，可能2000萬咁啦。嗰個就已經計咗係6成分同7成分嘅啦。咁即係計咗啲分就唔同部門會有啲唔同嘅，譬如食環同康文署會有啲唔同嘅。咁但係都係基本上大比數6-7成係由嗰個標價決定嘅。咁當個由標價決定嘅時候咧，其實咪變咗必定係要壓低個工人開支咯。咁就變咗係系統性地係低薪啦。咁但係如果我哋可以喐到個評分制度咧，咁嗰個外判公司就有啲嘅誘因咧係可以提升翻啲工資。 咦，輕咗嘅，咦，唔係佢輕咗嘅，佢輕咗嘅，聽到嘛？聽到嘛
Hello, can you hear us?
Okay, sorry, 聽到啦 ，OK。
OK。
係聽到 ，sorry。
Promise 嗰度
Sorry, can folks hear me? Hello?
Promise?
Sorry, I can't
Okay.
hear.
Yeah, so okay, I'll just try to translate some of this. Oh. Can you hear me? Okay, cool. Yeah, so sorry. Just connect. Making some changes to the outsourcing policy in Hong Kong. I see some.
Yeah, promise your connection seems a little bit sticky.
Can someone hear? Can folks hear me now? Okay, sorry, I think I'm back. Sorry, just to translate. So yeah, in the last 2 to 3 years, there's been some minor changes to the outsourcing policy that's been beneficial for the workers. It's hard for them still to demand large-scale changes to this outsourcing policy, but in the last couple of years ago, they had a very important fight where they were able to win some minor changes. And to talk about how like 60-70% of a lot of the work abides by a certain kind of standard, and that standard is very low wage. That still that would companies that abide by that wage standard would end up pushing systematically like the wage down for the workers, right? And so they're managing to try to shift that, for more companies to not take up that standard to fight for higher pay wages for the workers. And yeah, so minimum wage is still really low, and they want to kind of put that higher. But yeah, I think the big question is how do we fight for minor changes in the structure? Sorry, am I clacking up? Sorry.
I think, promise you were breaking up again there at the end as well. I can speak to the Local 26 in the US question. So, I think I'm very excited. I think we're very excited about further opportunities for coordination and obviously unifying a set of demands as our sister in Malaysia held up that we could take to our different governments, including the ones from our brothers in Colombia, that there be open patents so that workers around the world can get access to the vaccines more quickly, we would be very excited about. I also think in this question of subcontracted work that all of us are facing and all of the rights that undercuts for workers around the world, we do need to do a set of investigations and research that I think would help us start to see the actual connections, because the multinational companies that are doing cleaning in many of our countries, the privatized healthcare companies that are subcontracting out the work in the first place, I think there could be a lot of overlaps in the actual ownership structures and the flow of money behind those, because those are very similar processes, even though the context of each country seem quite different. That move to privatization and those who are benefiting from that seems in many ways very parallel. So I think with some research, we might actually even have some of the same major global companies that are pushing some of these concepts in different countries. And I think if we identified that, it would give us a way to start to do campaigning that is not just making demands on our respective governments, but on some of the very same multinationals. One possible version of this, I know Brother Martin in Colombia, many of their union members work for Sodexo. Sodexo is located also here in the US, and we have members that are a part of Sodexo in the Twin Cities. Looking for some of those overlaps could give us a way to build out the next layer of work. So we're excited, whatever path that is.
Thanks. Can folks hear me now? Sorry, a connection just died for a second. Okay, sorry. I won't talk too much in case it does again. So, Yishan? Yishan, did you go over? Oh, sorry.
No. Oh, I mean, I'm wrapping up, right? This is the last, yeah. So I think the solidarity among internationally, solidarity is very important, especially on this matter. So I think I'm pretty sure that this can act as a pressuring group that really can pressuring the government, because we see a lot of problem coming from the government. So I really hope that the the joint action group will found and we can work on that. Yeah. Thank you.
Thank you, Yishan. And lastly, we'll wrap up with any closing thoughts from Martin in Colombia.
Martín, ¿usted
Prende
quiere
el
decir unas
micrófono,
últimas
Martín, por
palabras?
favor.
Yep.
Prende el micrófono. Dale.
Sí, listo. ¿Alguna pregunta o qué?
Un último comentario, Martín, como recogiendo lo que aquí se ha hablado. Ustedes han planteado.
El problema, si no lo empezamos a trabajar desde acá, de este foro y los que nos hemos reunido, pues va a ser difícil de que esto cambie. La solidaridad entre todos los trabajadores del mundo y seguir en esta lucha, porque está difícil para todos los trabajadores del mundo, pero podemos salir adelante si nos unimos y nos organizamos y seguimos luchando. Muchas gracias.
Oh, pardon. So he said that, same as he had said before, that we really need to get all together to make sure that our voices are heard. And again, like globally, but also locally, to make sure that, like our rights are being respected, and that, like the rights that we are reclaiming as employees, as workers, as frontline workers, are not like a favor that companies are doing to us, but it's something that we deserve. And again, like, thank you for joining this team, for joining this coalition. And he's confident that out of this, good results will come.
Gracias a todos los intérpretes también por su trabajo y la parte técnica que nos apoyaron.
Gerardo just thanked all the interpreters for helping to pull together the logistics of this meeting.
Yes, thank you so much to the interpreters. And on that note, I know we've gone way past 90 minutes, so I think there's a lot of this is just the beginning of the conversation, and I think we already have a very interesting and powerful proposal on the table. Thank you, Miss L and Yishan and others echoing and building on this idea. I think, yeah, we have a kind of chat already with the speakers in the different regions. So I think definitely, I think on the back end, we'll pursue and look into, what this idea of something like an international set of demands can look like, right, for each area, and act as kind of a pressure group as well. So on that note, yeah, thank you everyone for coming again. And we might send out a survey afterwards to see, what folks feel, or are there any types of improvements to be made. And again, forgive us for the technical difficulties around the language thing, but I think overall, I think it was a very productive exchange. On that note, before we wrap, I'm going to pass on briefly to another Lausan member, Ed, to advertise a short event for other workers who are also organizing.
Hi, everyone. Just want to do a quick shout out, actually. It really goes to show that we've had so much support from unions from different countries, even those that didn't speak today. So just want a quick shout out to Gig Workers United from Canada. You could see their logo over here. They help share their events with their members. And they were basically the union that successfully organized Fedora workers here in Toronto. And they're now expanding to organize other gig workers, including from Uber Eats. It's a big day for them tomorrow as they're relaunching this new initiative to reach more food delivery workers. And they would like to invite everyone to participate in their launch event tomorrow. So in order to find out more about that, just look up Gig Workers United on Facebook or Twitter. And yeah, hopefully we can use this opportunity to build more ties between all of our different unions around the world. Thank you. In solidarity.
Thanks, everyone. Follow each of the unions on social media, and yeah, let's all talk again soon. Bye.